So I have an order to take out the Foley catheter for my patient. So I'll verify that. I would come in, knock on the door, introduce myself. Hi, I'm Kayla. I'm going to be verify the name, date of birth, and any allergies. I'm just going to tell them what's going to be happening. I'm going to be removing the Foley catheter today. So the first thing I'm going to do, I'm not going to raise the bed yet. I'm going to drain the bag into a graduated cylinder. So I would have my cylinder and I'll drain this, and I would have gloves on, and I would take that and I would measure that and document the coca, so the color, the odor, the clarity, and the amount of the urine. So I would flush that down the toilet, throw it away, or clean it according to my agent's policy. So after that, I'm going to wash my hands, and I'm going to put on a pair of clean gloves. And then I would raise the bed. So I'm just going to be removing the catheter now. So the materials I need are a clean drape, and a 10 ml syringe. So I would just take my clean drape and place it underneath. And let's say, can you lift up a little bit? So that's clean. So the next thing I'm going to do is I am going to take my 10 ml syringe and I am going to deflate the balloon. So I'll just be holding this, just making sure that it pops out here, and then insert that into the trash. And again, just doing it one more time just to make sure that I got everything. And nothing else came out. So the next thing I would do would be I would remove the strap from my patient's leg, and I would just slowly pull this out, grabbing the tip of it, and wrap it all up inside my drape, and then I would throw that away. So I would wipe if they needed anything to be wiped down, take my gloves off, assist my patient to a comfortable position, and then from there I would tell them that, so if there were a male, I would set the urinal next to a bed. If they're a female, that they would have a hat in their toilet. So I would just instruct them, the next time that you feel the need to void, or you do void, either void in the urinal or void in the hat, and please try not to get any bowel movements or toilet paper in the hat. Also, do not flush the toilet, ring your call bell right away, and I'll come in and I'll take care of it. So I'll tell them that, do my teaching, make sure that the bed is lowered, wash my hands, and go and document. So document that I had an order to remove the Foley catheter, that I removed the 14 French Foley catheter and the 10 ml balloon. I would document that they are due to void in 8 hours, how they tolerated it, and the coca, the color, the odor, the clarity, and the amount. So the amount I would put in the patient's INOs, the flow sheet, and the patient's record. So then it would all be done, and the Foley would be out,